Well, hi, everybody. I haven't done a Facebook Live in quite some time now. And today I am really, really happy to have a friend and colleague, Dr. Becky McGilligan, join me today. Dr. McGilligan has a wonderful practice in the Anderson area. She's a terrific internist. And we, as both internal medicine physicians with independent practices, have been facing issues with getting COVID vaccine for our patients. And I've been getting so many questions that I thought today was a great time to try to update everybody on what's going on, because frankly, it's really kind of a mess. So as I've done before, I always start with some statistics just to orient everyone. So I'll quick run through these, and then I want to let Becky tell us about her experience and what's going on in her practice. So worldwide, 94 million cases and 2 million deaths. Huge number, looking at about a 2% mortality rate. In the US, we are at 23 million cases with 400,000 deaths, about a 1.7% mortality. Oh, that's fun. Sorry. At about 1.7% mortality. The next highest country in terms of cases is India with 10 million. So if you think, we are way ahead of any other country by far. Ohio, 800,000 cases, about 10,000 deaths. So our mortality rate's a little bit lower here, 1.25% mortality. Now, today's really about vaccines, though, and I want to really focus on that. So as of today, about 30 million doses of vaccine have been distributed. Distributed meaning delivered to states. Only about 12 million of those have been administered. Interestingly, it's not quite an even split between Moderna and Pfizer. 6.5% million doses of Pfizer have been administered and about 4.5 million of Moderna. And as I've been telling patients, and as I know as a physician who got vaccinated, you really don't have a choice what vaccine you're getting. It's whatever's available at that location. My husband got Pfizer, I got Moderna. Now, what we know about in the state of Ohio is that we've received 960,000 doses, so just about under 1 million. And right now we're at about 360,000 doses have been administered. Now, what's frustrating, if you just look at the statistics and you look at other states, which is we're at about a 30% administration rate compared to other states. And the best ones in the US are really North and South Dakota, who have over 70% of the vaccine that was allocated to them already administered, and Connecticut is at about 65%. What that means is that they've already done about 6%. The best performing states are at about 5 to 6% of their population has already been vaccinated. Now compare that to us, which is at about 360,000 doses have been actually put in people's arms, and we're at now 2.9% of our population compared to the 5 to 6% in other states. So on a list of how we're doing compared to the other 50 states, we fall at 28th. So, and my concern, and I don't know if Becky's I don't know exactly what Becky's gonna say, but we both share some frustration with this. What I'm worried about is that actually as vaccine goes forward with the current plan in Ohio in terms of how we're gonna distribute it, that we're actually even gonna fall further and further behind. Because from my experience right now, the way in which we're trying to roll out this vaccine in our state is very cumbersome and is making vaccine rollout slower than it should be. So with that said, I would love to introduce Dr. McGilligan, who is going to talk about her experience in her practice, and then I'll tell you a little bit about what's going on in mine.
Okay. So we did sign up to be a location to give vaccine to our patients and to other people in the community. And we were approved. There was a conference call that I was on, and I think Dr. Larkin was on as well. We didn't speak, we just listened on Monday. And that was a bit discouraging because we basically learned that it's going to be very unlikely that we get vaccine for the Tier 1B round. It's my understanding that it's going to go to the hospitals, to federally qualified health centers. So Health Source will have it, Walgreens, CVS, Kroger, and the health departments. And having dealt with the health departments to get my staff vaccinated, that is a cumbersome process. And I was able to get my staff vaccinated just this week. And I was vaccinated 2 weeks ago because I'm on staff at Christ Hospital. Thank you, Christ Hospital. I too got the Moderna vaccine. My staff with the health department also got the Moderna vaccine. It is kind of you get what you get and you don't throw a fit kind of situation with which one. I would have taken whatever. And so what we've started doing is asking patients when they call, and I have a staff member who's actually calling my 80-plus-year-olds who are the ones who are supposed to be the first to go next week, and asking, are you Claremont? Are you Hamilton? Because that's mostly what I see, although we have some people in Warren and Butler counties as well, and I do have some people in Northern Kentucky as well. And then helping them get signed up on the health department side at least. So I can talk about that. Do you want me to mention that?
Yeah, go ahead. Yeah, sure.
Okay. So Claremont counties, I live in Hamilton. My staff, a lot of them live in Claremont, but Claremont County's website, if you just even put in your search bar, Claremont County Health Department COVID-19, and I printed out, this is kind of, where am I at? Okay,
yeah.
there we go. That is where, that's what it looks like on the website. And they list how you can register beginning January 16th at healthsourceofohio.org. Now, as a federally qualified health center, I do believe anybody could go there. And I don't think they have the right of refusal, but I could be wrong. Don't quote me. Kroger, also starting tomorrow, January 16th, has a website and it's on the Claremont website, and I'll put it up here. People can see it. Is it backwards?
Yeah, no, it's good.
Okay. So it's www.kroger.com/Ohio COVID vaccine. And so they list on Claremont County's website all of the Claremont County Krogers that will have it, but this link is good for all of them. If you live in Hamilton County, the state, it sounds like, wants you to get your vaccine in Hamilton County. If you live in Claremont County, they want you to get it in Claremont County. And there's also on the Claremont County website a link for Meyer, and that would be all the Meyers. And then the Claremont County Public Health, there's a survey you can take to give your information. So my staff member has been putting patients' information in the health department system, but that health department system does not go to Kroger and to Meyer and to all these other places. You kind of just need to sign up everywhere, and whoever gives you that call first, you take it. And then go back to the same place. I think, I mean, I could be wrong with that too. We'll see what Dr. Larkin says for the follow-up. So that's what we're doing right now, reaching out to the ones who are going to be next week, making sure that they know what we know so far. And then I guess we'll do that next week too for the 75 pluses.
And what are you telling patients about when you think you're going to get vaccine? And are you saying anything now, or just trying to use the other available locations?
I tell them that if we do get vaccine, we're going to post it on our Facebook page. I'll make a blog post. We'll send an email out to everybody. We'll call the people in that age range, or whoever's available, or not available, whoever's in the category of people who Ohio says we can vaccinate at the time. But I don't have high hopes that we're going to get it anytime soon. I mean, maybe your hopes are higher than mine. I've learned to have low expectations, so I'm not disappointed. Unfortunately, I have had my expectations dashed a little bit with this thing.
Right. I mean, I think we all have. Mm-hmm. So for my experience, I'll tell you what's going on. I will tell you, and many of you, because you've called the office already and have talked to me, realize and see my social media posts, the level of frustration I feel with this process. So as I've told you, Ohio is low in terms of our percent of vaccination, and our rollout process, I really believe, is not very effective right now, and is not going to make it easy for us to quickly vaccinate a large number of patients. And I really, if Governor DeWine, you're listening, I really think that the process quickly needs overhaul. And if you ask me, I would tell you that I think there's a great advantage to having a central vaccine location, and we should have many of them across the states. And I listened to Governor DeWine's briefing from last night, and he talked about really why he didn't want to do the central locations, because he said that he didn't want people, waiting in line and waiting in their cars. And so really described it as, there was going to be upfront pain, meaning slow lag time to schedule. But then when you went in to get your vaccine, it would be more seamless. there's several problems for me with that argument because, I know from my own looking at where I got my vaccine, which is at TriHealth, that right now, and by the numbers, right, that there's about 600,000 doses that really are somewhere out there in Ohio and have not been utilized yet. Governor DeWine spoke yesterday about some of them being held back. That was originally required for the people that had already received their first dose. That's not being done in other states. I don't really understand that. You may have heard on the news now that the feeling is don't hold things back. Just the pipeline is really getting better. So just start using what you have and start to immunize people. And really, I think that that's what should be happening, and it's really not, because again, we only have 30% of the vaccines that are allocated to us have been used. So I think we need to do better. And my recommendation would be to have a centralized vaccine site, maybe the Duke Energy Center, for example, where all of the health systems could provide staff on a rotating basis to do the immunizations. And it just seems like that would be far more efficient. Okay, so exactly like what Becky said, I have had the same experience. So the process with applying to be a practice that would get vaccines, let me tell you, was painful and cumbersome and frustrating at times, right? So Becky and I both give vaccines all the time in our practice. We know how to do it. We know how to manage our refrigeration and cooling to keep the vaccine safe. We know how to have patients sign informed consents. And so this seemed very cumbersome to be a process. The process was really time consuming. Next, then, we've gotten very little information. So as Becky said, they're doing webinars that we have to participate in, right? There's the many hoops that we have to jump through to actually be a site in terms of having staff training and having a clear plan for administering the vaccine. But even with doing all that, where we are right now, and I've been frustrated to tell my patients this, is that I have zero information, just like Becky does, about when actually I'm going to get vaccine in the practice, right? So, and until today, and I'll give you a little bit now as we're starting the 1B rollout, a little more information like Becky just gave about Claremont County. But really, Becky and I would tell you, as a primary care doctor who wants to do a good job, we are very passionate about trying to provide a service to our patients. We believe in vaccinations. We want to get the COVID vaccine out there. We want to do a good job and provide to the community as well and provide a community service. And this process has been impossible for us to navigate, really. And even today, as Becky said, I cannot tell a patient if I'm going to have any vaccine in 1 week, 1 month, or 1 year, or how many doses. So in this process now of telling patients if they're 80, starting Monday, they can start to get the vaccine, the following week it's 75. The problem is there's really like no vaccine available. So, or not much vaccine available. So this regimented process, and again, for me, with no vaccine, I can't even help my patients right now, and I can't even give them lots of clear information. So what else is going on, though? So again, Governor DeWine, and there's been lots of press briefings now with rolling out the 1B, and different than in other states where, for example, in Florida, it's just everybody over 65. The CDC says we should just be vaccinating over 65. And frankly, I think that's what we should be doing in Ohio. So again, Governor DeWine, if you want to hear my opinion, which you probably don't, I think it's arbitrary 80, and I'll tell you why, 80, 75, 70, 65, week to week doesn't make any sense. Well, first of all, it doesn't make any sense because we don't have enough vaccine to immunize all those people in a week anyway, right? The second thing is, I can tell you that an healthy 81-year-old patient that I have in my practice is probably lower risk than my 65-year-old with many comorbid medical conditions. And it really is kind of arbitrary, right? I understand the concern. Certainly, the older you are, the higher morbidity and mortality from COVID. And of course, I want to take care of my elderly patients. And I think Governor DeWine has done a good job in vaccinating patients in the nursing home. But the problem is now with community residents, the age doesn't really, there's no data that says that at 81 versus 79, you have a different morbidity and mortality, right? And I think that, again, really as a practitioner and a clinician, that actually I'm the better one to decide who really should go first in my over 65 population, because there's really patients who are 65 who need the vaccine ahead of my 81-year-old, right? And so the other problem is that with the way we're doing this, we'll start vaccinating 80-year-olds this week. But next week we'll start going to 75, but all the 80-year-olds won't be vaccinated yet because we still don't have enough vaccine, right? So we're just backing everybody up for a way that makes it a cumbersome process and, again, puts handcuffs around us as a provider, if I had vaccine, which I don't, to be able to administer it, right? So it's just all of these barriers that have been put in place have really limited our ability to provide vaccine to patients. Okay. So I don't have vaccine. I'm not happy with not having a central vaccine site. I don't think this age thing going 80, 75, 70 makes any sense. That's my opinion. But what's really happening now? Yes, yesterday I listened last night to Governor DeWine's briefing, and I actually was really excited today in that I was promised, and it is live, is that if you go to, it's covid19.ohio.gov, that you can find a listing of all of the vaccine sites in Ohio and put in your zip code and be able to see immediately where your closest vaccine site is. Well, number one, that search engine to put your zip code in doesn't work, but I was able to sort it based on Hamilton County. So there's over 400 listings there. There's 45 sites listed in Hamilton County, including the health systems, UC, TriHealth, Christ, addition to Kroger's, pharmacies, and the federally funded clinics, as Becky mentioned. So there's 45 locations in Hamilton County. And the problem is right now you can't schedule at one of them. There's no direct way to schedule online. And you can do nothing. So if we're supposed to start vaccinating 80-year-olds on Monday, I can tell you we don't have a plan to start doing that. So, I mean, not a real plan. I mean, so I understand, again, from talking to leadership at some of the different health systems that, again, we're all trying to build the plane as we fly it, because, of course, everyone is committed to trying to serve the community and get the vaccine out there. But again, you want my opinion, maybe you don't, but every health system doing it differently just is duplicating work. It would make so much more sense to have a single location and a single scheduling platform where patients could schedule and go. And it would really decrease the fear and anxiety of patients and the number of calls and things that I'm getting. It's just this, and it would speed up our vaccine administration, because I can tell you, I just don't have confidence that this system is going to go well. And I'm frustrated that even my 80-plus-year-old patients right now don't have rapid access to scheduling. You can, and I see a patient has already commented about this, which is you can go, and you should if you live in Hamilton County, to register with the Hamilton County Department of Health. And you're correct. It's not right now a vaccine appointment. What it is you putting in your birth date, and they will notify you when you're on a list and you meet criteria, and they'll send you an email. But the problem is, just as Becky said, right now, it's everybody fending for yourself. You need to go apply on the Hamilton, put your name in on the Hamilton County site. You're going to need to now go and put your name on the Kroger site. You need to go look at it, put your name on the TriHealth site or one of the health system site, and kind of see where you get called up first for, right? And that just doesn't make any sense. It's duplicating effort and making it cumbersome for patients. And I just don't think patients should have to work this hard to actually get the vaccine that we've had 10 months to prepare for. So we could get into a whole political discussion about what happened, but we're just not, in my opinion, doing this the way that it needs to be done. Becky.
It's harder to get a vaccine than to get a PS5 for Christmas.
Right. Right.
Well, I had one thought too. Another place that I didn't mention, and I don't think I heard you mention either, was the Veterans Administration. If you are a vet and you are with the VA, they are giving vaccine. So reaching out to the VA if you have any connection there is also a very good option.
Right. I did mention that, and thank you for mentioning that. All right. Well, I will take some questions if that's okay. And it looks like there's a bunch. Let me go up. So there's a question about the Hamilton County Public Health Department registration just tells you when vaccine is available. How do we actually register to be on the list? So there is a place, again, to put in your information so that you will be notified, but it's basically like signing up to get an email newsletter. You know, when they decide, it's like they probably don't know when they're going to have enough vaccine yet either, any more than I know when I'm going to have vaccine. So that's probably the problem. And they're collecting names and information. And then again, with vaccine availability and their limited resources, they'll contact you. But again, I would encourage everyone to submit your name, to go on the state website find that ones in Hamilton County that are close to you, go in individually once those sites are live to schedule, and start scheduling at multiple sites.
Now, my staff did use the Hamilton County website. I felt initially, up until like a couple of days ago, it was only for 1A, that survey, and you could fill it out for yourself or for your practice. And I had done that probably like 4 weeks ago, right as soon as I was informed that we could do that. And I didn't get an email for my practice until Wednesday, giving us a link. I was able to find out from another private practice physician that there was a link over last Friday that I only had 3 staff members. It's a small practice, where they could get signed up to get the vaccine. And they had actually already all been vaccinated by Wednesday when I got the link. So I do recommend filling that out. They will eventually send you an email. It will have a link to go through a mostly cumbersome process, if it's the same one I went through their system that you sign up for an appointment. But if you find another place to get it first, do it.
Agreed. So here's one. Any idea when the Johnson & Johnson vaccine will be approved? Becky, do you know? I know it's coming up the pipeline, but I would, as far as I know, they haven't even submitted to the FDA yet to get the EUA approval. So I would guess that we're a month, 2, 3, 4 out, but I have no idea. This is from a school administrator. If names were submitted by employer, do you recommend multiple registrations for employees? I don't really know the answer to that. Right. I see your other question from the same person. As a school administrator, we're very concerned about the dysfunctional rollout for teachers, right? Becky, do you want to comment on that? Because I have some opinions about that too.
I mean, I feel like I don't know what's going on with that, because, it seems like they would be, depending on the tier 1, I think, is it week 3 that they're starting to do teachers of tier,
right?
It's the beginning of February.
When they get to 65, then the teachers.
And then are they supposed to sort of a free for all to go to these places too, or is the health department, like they did with firefighters and paramedics, are they going to come to the individual schools? So I don't know. I have not heard any guidance on that, and I've got quite a few school teachers and principals in the practice as well.
Right. I mean, from my vantage to this person, this is exactly the same thing as what's happening with the rollout to 80-year-olds, right? Okay, so it's great to say, okay, it's time for the teachers to get vaccinated, but we have huge numbers of, obviously teachers in K through 12, and then we have lots of college professors all over the area and huge numbers of faculty that all need to get vaccinated as well. And so it's great to say that February 6th or whatever the date is, that it's time for teachers to get vaccinated. But as far as I know, there's absolutely no organized plan. So to Becky's point, this is where I think we absolutely need a central location, because it's going to be, again, large numbers of people that are going to have to try to go online, register, and fend for themselves. And I just don't see any clear path to doing it efficiently when we have to get so many millions of people vaccinated, and we're just not there yet. So I'm really of the belief that, again, Governor DeWine, you don't want to hear my opinion, but my opinion is we have to have rapid overhaul very quickly of how we're implementing or we're doing vaccines, or we're going to fall way, way, way behind all of the other states. And I really believe we have to have these drive-through centers. The other thing that I'll just mention, and Becky, I don't know if you want to comment on this too, which is, again, we are physicians, we're dedicated to our patients, and we also want to do right in the community. And so we believe in community service, and we are all about that. But Becky and I also run our own businesses. And like, many of you may have heard that lots of primary care practices across the US did not survive during the COVID epidemic because of financial hardship. I think Becky and I feel really good that we've survived and navigated it well. And I think my patients have really been relatively happy. I hope for those of you that are watching that, we really tried to accommodate and transition and help our patients during the pandemic. But right now, I will tell you, this vaccine rollout, for me as a private practitioner, has been huge amount of time, energy, work that's made harder because of the level of dysfunction in executing it, right? I told you, I know how to give vaccines. Give me vaccines. I can vaccinate. So there's this whole rigmarole. I've got to do all this reporting, mandated reporting, which, okay, but wouldn't it all be easier and be more effective and save money to have it all down at the Duke Energy Center? And everybody, I'd go down to the Duke Energy Center and spend 2 days and vaccinate people, right? I think we'd all go down and contribute. But wouldn't it make more sense to have vaccines shipped to one location, and we have one scheduling thing, teachers can go there, everyone can start to go there, as opposed to what we're doing now? Because there's huge cost to me, right? So I want to do this, but there is huge cost, because one of the requirements of me being on the vaccine site is that when we get the vaccine, we have to start administering it within 24 hours. And hello, if I don't know how much I'm going to get, when I'm going to get it, how can I prepare to administer the vaccine starting the next day and even tell patients? I mean, my hands are completely tied, and you can tell I'm frustrated. Becky.
So we had blocked part of my schedule each day, and I figured, if I don't get vaccine that day, then I'll just use that for urgent visits and for phone calls. But that's not something that's sustainable long term. You can't block out like half your day to not see patients. The other thing is, how are you going to? The good point, a big point is if you have to start giving it the next day, how do you know patients are going to be able to come during those time slots?
Right.
If I get a Moderna vaccine, there's 10 doses in each vial. I've got to have at least 10 people here and arms to put it in. And it is a disaster. I saw a question here, though, from a Kentucky resident. Since we are both practices in Ohio, but I know I have Kentucky patients, and you probably do too.
Maybe that's going to you. Which question are you?
It was, as Dr. McGilligan's favorite patient, but a resident of Commonwealth of Kentucky. Will there be residency restrictions that prevent me from getting a vaccine through her practice? And should I look in Kentucky? So it does look like there is. The system that we have to put the data into that Dr. Larkin was mentioning, it includes your address. And they made a big deal on Monday in that conference call that she and I were on, that if you're in Hamilton County, you have to get a vaccine in Hamilton County. So I guess I could even only vaccinate my Hamilton County residents based on what they're saying, which doesn't make any sense. Right. So I would look in Kentucky. I would look at St. Elizabeth's, because I think that St. Elizabeth's is just starting to do patient scheduling as well. And I would look at the Walgreens, Kroger's, and the CVS's of the world in Northern Kentucky, and whatever your county health department is. It is a disaster.
Right. I see a good question from someone about the healthcollaborative.org site is the one-stop shop to register for the vaccine. Okay, so I just posted this site on my Instagram just about 15 minutes ago. I just became aware of this. So the Health Collaborative does good work, and they really try to help integrate all of these different pieces throughout the city. And they have really worked hard, it looks like, to develop a single site where people will be able to schedule. If you look at the site right now, if you go to that site, again, it shows the health systems and a couple other places right now. And I think Kroger's is on there as well, but the site's not live. There's still no way to schedule through that. I have no idea when that is going to be live. Maybe that will streamline things enough to make this better. Gosh, I hope so. But it's not live yet, and I have no experience with it. The website looks very pretty. It's a pretty purple. And again, I'm kudos to them for developing it, but it's not a saving grace today anyway. And maybe back to the teacher thing. I mean, maybe that's the site that teachers will go to. I don't really know. Now, I'll make a comment just about the Hamilton County, Butler County, Claremont County. So, believe me, I would love to tell you that I think vaccine rollout is completely fair across the US and that everybody is doing it the way that they're supposed to do it. And I can tell you that they're not. It's different in every state. And again, very early when the vaccine came out, it was very clear to me that a 65-year-old with diabetes and congestive heart failure in North Dakota versus Georgia versus Arkansas versus Ohio versus Connecticut is going to have access to the vaccine at all different times. And so I understand what Governor DeWine is doing. When he talked on his press brief yesterday, he talked about really allocating basically equivalent doses of vaccine to all of the counties. And so we want people ideally within their same county to get the vaccine in that county. But the truth is, in my opinion, it's relatively arbitrary. And really the faster, more seamless way to do this is just where you can get the vaccine, and preferably, as you've heard, in a central vaccine location site, everyone would just start getting vaccinated, because we should just be putting all of the vaccine into central locations and just having people go. Because the gist is, the more cumbersome and hard you make this, the slower the rollout is going to be. And we need to get the vaccine in people's arms.
There was a question about whether people in Ohio can go to Kentucky since they're rolling out to 60 plus on February 1st. I don't know. And that's the other thing. I hate not knowing.
Right.
And a lot of what I've been telling patients is, I don't know. Sometimes patients are informing me of things, which I'm happy about, anybody who has information. But I think one thing I'd like to say too, is that it's very frustrating for us. We know it's frustrating for you. It's also frustrating for the pharmacies,
yes,
and the pharmacists and the techs. I've read about how in other states, some of the governors say, call Walgreens, call CVS, see if they have any extra doses. I mean, they're still filling prescriptions too, and they don't. And so some of these pharmacies' phones are ringing like with a question about, give me a vaccine, like every 8 minutes.
Right.
So
that goes back to what's the unintended consequence of this rollout plan, having it all in local locations and health departments and health systems doing it, right? Nobody knows where to go. So, I mean, I don't know about you, Becky, but it's been frankly overwhelming. As I've said, for me personally, the number of emails, texts, phone calls, messages in Epic, not in Epic, on my phone that I'm getting, and phone calls and, calls to the office has been frankly overwhelming. And we have other things to do and other patients to see, right? Which is one of the reasons I'm doing this Facebook Live, because I know how frustrating it is for patients. And believe me, I want to help you. I would really like to be able to direct you to get a vaccine in an easy way. And it's just really, really frustrating for me to not be able to give you accurate information. And it's really hard. All right. As a home health aide, I've heard nothing of when we would be eligible. Any ideas?
Oh, wouldn't they be 1A?
I would think
I would call you 1A
now. Now the question is, I have no idea. I would think you could schedule on the Hamilton County site or the Claremont County site, wherever you live, as a home health aide and be able to get the vaccine. But
no, they definitely are 1A. I have some home health aide patients who got it before I did.
Is that right?
Mm-hmm.
Right. So I would encourage you to get on those sites and put it in that you're 1A. But again, wouldn't it be nice? He's rolling out the vaccine February 1 to 60 plus. Can an Ohio resident, we talked about that, go to Kentucky to get the vaccine? Oh, Becky, did I lose you? Yeah, now I can. I don't know what happened.
Huh. I don't know if I touched anything. So.
Well, I don't know what that means. Okay. All right. Understand the get what you get thinking for the vaccine. I also have heard that based on the use of preservatives in some more than others, all may not be a good option for me. Will there be a point where those of us with unique health concerns will be able to have a say, or is that just too far down the line? Mm-hmm. Right. So the issue is, it's right now so limited supply. I mean, I predict that as we vaccinate millions of people, we will get more information about the vaccines, both in terms of duration of effectiveness, how long, the spike protein that we develop actually confers immunity, and we'll understand the side effects more. Once it's readily available, I think then people will be able to choose likely which vaccine that they get. But I think that's a long way off. In my opinion, and Becky, I'd love to hear yours, is right now, I think they're equivalent, and I would get whatever one you can get, because I think it's much more important to get it.
Mm-hmm. I agree.
I'm a patient with you, Dr. Larkin. I would be there ASAP. When and if you get the vaccine, I am 55, so no idea when I will ever get vaccine. And I see clients every day over 65 as a physical trainer. Thanks for the information. So here's the thing. I have to believe that once we have adequate supply, and I think that will be sooner if we can just get it, that then we're going to just start vaccinating the masses. So my hope is that at 55, it's not as far off as you think. I mean, my hope is that that's late March for you. I don't know what you think, Becky.
Well, I agree. I mean, once again, I've learned to have low expectations, so I'm not disappointed. But I mean, we still hope. I hope in March I hope in March we'll have vaccine.
Right.
You know.
Right. I mean, I hope, and that's right. So, I mean, again, I think the bumpiest transition right now is going to be the next 4 to 8 to 10 weeks is my guess, when production is continuing to ramp up and we really are hopefully improving on our rollout in Ohio.
And I feel bad for the health departments because they are not set up. I mean, they don't run vaccination clinics like this. They are not. I mean, they're handling taking in all of the data on positive cases. We had to call today with a positive test, plus doing the vaccine, and it's just more than they can handle. And I think that's part of the sticking point too. It's a rate limiting step of having people actually put shots in arms.
Right. I wholehearthly agree. And it goes back to, this is why I think we need central vaccination sites, because nobody has additionally resourced the health department. They're overwhelmed with all that they're doing. They're short staffed. This is a huge endeavor. And again, wouldn't it make sense if the health department came in sometime with some staff and helped vaccinate, and doctors from Christ and doctors from TriHealth and doctors who are independent, and we all took turns doing the immunization on some schedule, but we all put our doses all in one collective basket and did it somewhere? It just seems like it would be so much easier for patients and clinicians, because frankly, the hospitals, have huge expense in administering this vaccine as well. So it was one thing when they're vaccinating their doctors and nurses and front desk people and workers, because they have to keep the hospitals open and they have to do that. But now to really burden them, again, everybody's taken a hit financially with COVID, this whole pandemic, and to now make it the burden of even the health systems for immunizing the community in this way just does not seem to make sense to me. But again, I'm not managing this. All right. What are the
run for office and
No, I would do very poorly in office. As you can tell, I'm too outspoken and opinionated. What are the risks for those who have allergy concerns? So Becky, you want to comment on that?
I mean, I once again, I don't think we completely know. They're still gathering more data. Every site that gives vaccine is supposed to have epinephrine and antihistamines like Benadryl or something in stock. You're supposed to wait for at least 15 minutes after you get the vaccine at the site. And I don't know how each site's going to do that. I know when I had it at Christ, I don't work at Christ, so I sat on a bench distanced with a mask talking to another physician friend of mine that just happened to be behind me in line. So you need to stay there and then they'll watch you. The one thing that I have heard is that if you have dermal fillers, they tend to swell. So maybe don't go to the med spa for a couple weeks before your shot. But that's anecdotal. So that's the only thing I would say.
Right. So if I know when I got the vaccine, I mean, they ask specific questions, right? Which is, have you had an anaphylactic reaction, meaning you've needed epi to anything in the past, including a previous vaccine? And so that's the only screening question they ask. And again, I think we're all watching this and trying to be as careful as we can. But without a specific vaccine allergy, I don't think anyone would restrict you from getting it, but they would want you to bring your own EpiPen if you have had a prior anaphylactic reaction, say to tree nuts or whatever you're allergic to. This is a good question about opinions on cancer patients on chemo. So if we talk about pregnancy, about breastfeeding, about cancer patients on chemotherapy, well, there's two questions: is should they get the vaccine right now? But the other question is, where do they fall in the lineup of when they're supposed to get it? And this is one of the frustrating things, again, for me as a doctor in terms of this rollout, which is that I really think I have patients like this who are immunocompromised, who would have higher morbidity, mortality on if they got COVID and should get the vaccine first, right? So a 30-year-old who's getting chemotherapy is definitely higher risk than a healthy 52-year-old, right? And yet right now we're a healthy 62-year-old or 65-year-old. And so I still believe that there should be this way to be able to facilitate that. But at least right now, that's not the way the rollout is going, and we don't have the ability to do that. The question about should they get it as a cancer patient on chemo? Absolutely. So if you look at the contraindications, there really are no contraindications, even pregnancy and breastfeeding. And so I would tell you that I think, again, if you're pregnant and you want to wait, or you're breastfeeding and you want to wait and you're a healthy young 30-year-old, I'm not sure that I would tell you I think that's the wrong decision. But we worry, again, that you would have more morbidity, mortality, and it's not a contraindication. You certainly could get the vaccine when it's available to you.
On Tier 1B, starting the second week, when it's the 75 plus people, the state also listed patients with developmental disorders and other chronic health conditions, but it does not spell out what that means.
Right.
So, I mean, if you have cancer and you're on chemotherapy, and I agree, definitely get the vaccine. I would apply with the health department still. I mean, I know it's putting more strain on them, but I personally, as a physician, feel you do fall in 1B. And there's going to be it's going to be hard to say, well, is asthma 1B or, is diabetes 1B, but definitely immunosuppression. If I would also think if you have Crohn's or ulcerative colitis.
Yeah, absolutely. I had a young 21-year-old patient with very serious ulcerative colitis, and she asked me to talk to her mother yesterday. And the truth is, again, I would prioritize that young person ahead of many older patients. And yet we have no ability to do that. This is interesting. I just called UCMC Neuroscience Institute to schedule spouse. I had mine today. The phone numbers on the ODH website is inaccurate. So I don't know if the person that wrote that was able to schedule your spouse, because I know that the person that wrote that is a healthcare provider. So I don't know. Again, that's not really what's supposed to be happening. But again, as I said, I don't think that the rollout has been completely fair in terms of following specific guidelines. There's definitely been some wiggle room in there. But certainly I will just say too that Becky and I know that when we said we would be a vaccine site, we really have to hold strict to the guidelines, right? Or really that is a big deal. So for patients listening, I will tell you, I hear everybody's concerns. I wish that it wasn't this 80, 75, 70, 65 staggering, as I said, but I'm not going to be able, if it's me giving the vaccine, I'm not going to be able to have you jump the line. We're going to have to follow the guidelines from the governor for sure. Becky, you take this one. Can you talk about the new variant that has been found in Ohio? We obviously are not performing the sequencing enough here compared to other countries. So do we even know how long it's actually been here? When do you think we'll know if the vaccines will be effective for the new strains?
So from what I understand, the assumption, which we shouldn't make assumptions in medicine, is that it is effective because it's the spike protein that we're targeting. But other than that, it's another one of, I don't know. I hate this. I hate answering questions with, I don't know. Time will tell, I suppose. Do you have any other?
No, my understanding, and again, this is just like Becky said, throughout this pandemic, we all had to be very careful and should be very careful not to speak in anecdotes, right? Because, for those of us, and I know Becky feels very strongly about this as well, right? Evidence-based medicine, we really want to believe in science and use data. And science isn't perfect and science evolves over time, but we shouldn't be doing things willy-nilly, right? So even with the vaccine rollout right now, what Becky and I would tell you is when they applied to the FDA for EUA approval, the trials, although very large and very diverse and very well done and really executed very efficiently, amazing. And that was one of the successes of the pandemic. They only had 2-month follow-up for post-administration, right? So we know that the vaccine is effective for 2 months. We know the limited side effects that we saw with 2 months of the dose, but we have nothing beyond that. So not only do we not know about these other strains, we don't even right this minute know how long the vaccine is going to be effective and when we're going to have to revaccinate. My understanding is that in the strain that was identified in Britain, which I believe is the one that's in Ohio as well, that one, the spike protein matches, and we think that that's going to be covered by the existing vaccines. As I understand it, the strain that's been identified in South Africa is the one that looks very different and that we're not sure that the current vaccine is going to work. And again, that is not evidence-based medicine. That is anecdotal from what I know, and I think more yet to come on that. If one has travel plans to Florida, will they be able to receive the vaccine in Florida? Okay. Start. Do you have?
I haven't had any patients do this trick yet. I have had a patient who has another home in another state closer by who was able to get on the schedule somewhere.
So I have, as this person knows, I have many patients that winter in Florida, both on the Gulf Coast and on the Atlantic Coast, in multiple communities. And I can tell you, I know that lots of my patients have gotten vaccines in Florida already. Now, with saying that, I will also tell you that my colleagues and friends who are in Florida gave me a hard time on social media for actually posting that. And I'll tell you why, because just like Becky said, even here in Ohio, we're trying to get people to stay in their same counties, right? Like, we're trying to make this fair. Well, the truth is, as I said, I just don't think it's fair. And I just want people to be vaccinated. And if patients, legitimately are able to apply, they have a home or they winter down in Florida and get the vaccine in Florida, I don't think that that's wrong. But my colleagues in Florida really pushed back and said, please, we don't have enough for our Florida residents. Please keep your patients in Ohio and vaccinate them. So believe me, I understand my colleagues in Florida who are mad at me for making that post. So I get it. Is it ethical if you really live in Ohio and winter in Florida to get it in Florida? I think it is, but clearly my colleagues in Florida are worried that they don't have enough for their residents as well. So I don't know. There was a question on here about that I missed.
The follow-up was, could you receive the second dose back in Ohio?
My understanding is you need to get the second dose where you are. Now, I'm sure that there are going to be circumstances where that just isn't possible for anyone. So even someone in Ohio, now suddenly something happens and they're stuck someplace else and need to get the second dose. I don't know how that works yet. I can tell you, Becky and I both got a little card with our first vaccine dose written down. I don't know if I took that vaccine card to Florida and it showed that the date was correct, would I be able as a healthcare worker to find a place down there to vaccinate me? I don't know. I would, if I were you going to Florida and trying to get the vaccine down there, I would try to plan to get your second dose down there. And then there was a question about a Washington Post article. So coronavirus update in the Washington Post this afternoon said that Operation Warp Speed admitted to the reserves never existed. They said the states are very upset. So I haven't seen the article yet, and I'm not sure of what that's exactly referring to. So I don't know. So I know that, again, they were having reserves for the people who got the first dose to make sure that people can get the second dose. I certainly hope, and my understanding was that the states had adequate doses for a second dose for the healthcare workers, so that's already been allocated. But maybe what they're talking about is now vaccine production is still going to lag behind. And so the people that are getting the vaccines now in the next couple of weeks may get a lag. I have no idea, but that's going to be a problem. That's going to be another big problem, right? So if we've now overpromised and don't have enough vaccine for the second dose on time, that's going to be a problem. So I don't know. I will read that article and see what I hear tonight on the news. So, someone just responded that they said they heard on the news that it was okay. So meaning, I think, okay, if you get it in Florida and you go down there, they said the more that get the vaccinated, the better. That's my idea, which is let's just vaccinate. I agree with starting with over 65, but let's just get it out there. So, all right. Well, if anyone has any other questions, please submit them. You guys were great today. I don't know how many people were on, but thank you so much for joining us. I hope it was helpful information, and really kudos to Dr. McGilligan, who's doing an awesome job. Hang on, maybe there's one more in her practice, and she has a new partner joining.
Yes.
I assume is taking new patients, right, Becky? So
will be. Dr. Katie Dumont is leaving Christ Hospital and joining me. And you can pre-register on our website, McGilligan.md. And if you pre-register before January 31st, we waive the registration fee. So,
well, awesome. Becky runs an amazing practice, and please, I would go to her website, and thank you everyone for participating. And if everyone on here doesn't know that we are both really trying hard to serve our patients, and I know your level of frustration. I'm as frustrated as you are. And please know, as soon as I have vaccine or have more information, I will communicate with you. So happy Friday, everybody. Thanks, Becky.
You're welcome. Thank you.